Hello everyone, greetings everybody. I'm Priyanjali from Beautiful Spotless Skin team. To look beautiful and smart all the times is a quest of humans, right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why today's live we are addressing a common yet impactful issue that affects millions worldwide. Acne goes beyond skin deep, often affecting emotional well being and self esteem. Despite its prevalence, there are many myths and stigmas surrounding acne. Join us as we delve into acne management with our skin expert, aiming to debunk misconceptions, foster understanding, and empower you with effective solutions for clear, healthy skin. Whether you are battling breakouts or simply curious, this session promises valuable insights and interactions. Today, we are honored to introduce Dr. Liji, a renowned skin expert. Dr. Liji K C is a distinguished dermatologist and cosmetologist hailing from Ottapalam, Palakkad district, Kerala. She completed her MBBS with first class honors from Government Medical College Kannur in 2015, followed by an MD in Dermatology, Venereology and Leprosy from the same institute in 2020, also achieving first class distinction. Her expertise was further recognized with the clearance of DNB in Dermatology, Venereology and Leprosy in 2021. With a robust academic background, Dr. Liji has contributed significantly to the field through her research, showcasing a commitment to achieving dermatological knowledge. She has presented her findings at prestigious national and international conferences, underscoring her dedication to scholarly pursuits. Currently serving as a consultant dermatologist at Vallu Hospital, Ottapalam. She specializes in clinical dermatology, cosmetology, and dermatosurgery, addressing a wide spectrum of dermatological concerns with precision and care. Today, we are privileged to have her with us. And she will be sharing insights on acne and its management. We extend our heartfelt gratitude to you, Doctor, for joining us. Without further ado, over to you with the first question. Can you please tell us what is acne and what are the types of acne lesion?
All right. First of all, thank you so much. Thank you so much for this warm welcome. So, acne is a very common condition we used to see each and every day of our clinical practice. Basically, it is a chronic inflammatory condition of your pilosebaceous unit, that is your oil secreting glands, and it is predominantly located over your face, on the T space of your face, forehead, cheek, not only over the face, but also on the trunk, like upper back, shoulders, and upper chest. And clinically, it is characterized in different types of lesions. The initial stage, it begins like, small, tiny, black and white bumps. It is actually comedons, open and closed comedons. We can call that as comedon. Usually, it is known as blackheads and whiteheads. Then there is skin colored tiny bumps, that is papules, and sometimes pus filled lesions. The patient may have pain over that, and the severe form is, pretty bigger lesions like deep seated pus filled lesion. These are these are the clinically acne looks like this, that eventually causes pigmentary changes and scarring as a sequelae. That is about what is acne.
Right. Doctor, acne is very common, we know that.
Yeah.
And we get to see in every second or third person. But let's talk about very basic things today. Very common things which people tend to make a mistake every single time, even after knowing the effect of it. So there are a
Yeah.
lot of people who tend to, press the lesion by nails, and, they have a problem of itching, mostly applying, rubbing the nails over any sort of lesion. So how harmful can that be? And uh, is it safe? Can that also form acne somehow?
Yeah, true. Whenever we squeeze it, popped it out, we are making deep injuries. Whenever injury occurs on the deeper layer of the skin, that will eventually definitely going for scarring. Somehow it will going for scarring. So it is a must. Don't do thing for acne. Don't prick your acne. Don't squeeze your acne. All these will worsen your skin health.
Right. Now, we have talked about one cause. Let's talk about the other cause. What causes acne mostly?
Yeah, it is actually multifactorial things. Basically, in puberty, there is a drastic change of hormones that will aggravate some kind of hormonal things, and that will result in pubertal acne. There is acne in adult also. That is basically on some kind of underlying issues like insulin resistance or PCOD is a non-cause. This is another cause for acne, and a lot of aggravating factors are there also. Like whenever we occlude the pilosebaceous unit, the clogging will aggravate acne formation. Even some bacteria over your skin, like propionibacterium, that will cause acne. All these are, together cause inflammatory process for your, that pilosebaceous unit,
Right,
eventually
right,
causing acne.
right. Well, apart from that, doctor, can lifestyle changes or food habits also cause acne?
Yeah, it's actually controversial, but a lot of studies shows that high glycemic index food like sugar, refined sugar, dairy products, then chocolates and all, it will enhance your insulin resistance and eventually cause aggravate acne. I would say aggravate acne, and even from my clinical practice also, I often observe the same. And I would say people, your patients should reduce taking this kind of high glycemic index diet and dairy products. That is especially for maintenance phase also.
Right, right. Doctor, what are the grades of acne?
Grades, all right. Actually, for initial assessment of the patient and assessing the severity, area of distribution, we grade acne mainly into four grades. First grade is the mild acne, simply with that kind of blackheads and whiteheads and few skin colored papules, the tiny bumps. Okay, it's basically
Right,
that clogging. That is the first grade, it's a milder grade. And grade two, along with this grade one lesions, patient will have some kind of pus filled lesion. We call it as pustules. That is grade 2. Okay, grade 3 is pretty bigger lesions like deep seated pus filled lesions, and it is nodules and cysts. And grade 4, along with the cystic lesion, there might be scarring. That is a grade 4. This is how we grade 1, 2, 3, 4 according to the severity.
right. And let's talk about the treatments now. What are the treatment options available currently for acne management?
Yeah. All right. For treatment, before going to the treatment proper, we should have some aims of therapy. Like, first we have to reduce the clogging, the blocking of your pilosebaceous unit. And somehow we have to reduce the inflammatory process. We have to reduce the bacterial colonization. We have to reduce the sebaceous gland, your oil gland overactivity. Last but not least, we have to take care of the scarring, pigmentation, even the physiological impact in patient. So the general management is the most important thing, irrespective of the grading of the disease. And we always start the management with proper patient counseling, patient education. That is, this is the course of the disease. You have to take long-term treatment. There is a chance of, often breakouts. And this most important thing, you have to be adherent to the treatment. This is how we start treatment. And coming to the treatment proper, we choose treatment based on the severity. For grade 1 acne, simply we are dealing with the, that we are removing the occlusion. A comedone extraction is a very basic, very simple procedure we used to do in our OPD. We are just removing the clogged pilosebaceous unit. Along with that, for the grade 1, we have lot of topical therapy. You know what is topical therapy? It means we are using the medication as applications. Okay, the first line medication is Retinoids, you might have heard of retinoids.
Right.
Tretinoin is the drug of choice for topical therapy for grade 1 to acne. Along with tretinoin, we have another molecule, benzoyl peroxide. It's also a wonderful molecule for acne. And others are, topical antibiotics are available like clindamycin, nadifloxacin, and all. In other molecules like azelaic acid, glycolic acid, lactic acid, even salicylic acid is a wonderful molecule for active acne grade 1 and 2. We can use it as chemical peeling with very good results. These are the topicals for first grade and even few for second grade. Coming to the grade 2 acne, here we'll have pretty bigger lesions like pustules, painful lesion. Here comes the importance of systemic therapy, that is the oral medication. Monotherapy won't work for acne always because we have to combine treatment options for better results. So the systemic therapy, we have a lot of antibiotics like doxycycline, minocycline, limicycline, azithromycin. These are the antibiotics for inflammatory lesion. Along with that, topical therapy we have discussed in grade 1. Then coming to grade 3, what is the problem with grade 3 is whenever conventional therapies are failing, we will go for grade 3 severe treatment, proper treatment for grade 3 with the systemic retinoids. I know systemic retinoid is it carries its own side effects, its own risk profile, everything, but we choose systemic retinoids whenever the conventional treatment fails to give better result for grade 3. And coming to grade 4, it's scarring, it's pigmentation. We have only remedy for grade 4 scarring is procedures only. The topical therapy or systemic treatment can't do nothing with the scarring. We should go for a lot of procedures for grade 4 scarring. That is the treatment. That is how we can divide the treatment in different grades.
Right. Now, talking about tropical therapies, which we have just discussed.
Yeah.
Doctor, we see a lot of patients nowadays. In fact, people are very much keen towards skincare. Maybe because of the internet, or there are so many influencers nowadays who are trying it on their skin, and then people they tend to follow them, like religiously they follow them. But is that safe somehow? I see a lot of girls, in fact, boys nowadays, they love doing their skincare because they get to see the result immediately. The skin starts glowing. We are so much keen towards Korean glass skin. And there is such a hype in the market regarding skincare nowadays. I see a lot of girls applying whatnot. So there is a proper process which they follow, this after this, and then layering this after this. So how safe is that? And if it's not, how can it harm the skin?
Yeah, true. Nowadays our market is flooded with product, lot of skincare product. Our new generation is going blindly behind the influencers and reels and everything. They use lot of products. One thing, it's better you keep your skin healthy with routine skincare product, but you should always consult your dermatologist. Each and every skin type is different, complexion along the sensitivity, its texture, everything, it varies between patients. So consult your dermatologist, start your skincare routine, that will be better. But what is happening, the trend is they are using lot of product, they get it over the counter, they use it in multiple layers, lot of the, always, we can see a lot of patients coming to our OPD with the acne along with the very sensitive skin. The thing is, they might have used some kind of topical steroids, and the overuse of that topical steroid always ended up with worsening of your skin condition. So skincare routine is good, but always consult your doctor and customize your treatment option. Not all products are not good for everyone. So please, this is my request for everyone, please don't go blindly behind your influencers or go with your home remedies, natural remedies, nothing. Consult your dermat before starting this. Okay.
Right, right. Well, we always say that you can have an idol, you can have a favorite actor or favorite actress in your mind, but they have also referred a dermatologist. The products they are using, it is suggested by their dermat. And the influencers which we are talking about, they are getting paid for it. It's their bread and butter.
Yeah.
So you can't follow them. You never know if they are actually using the product. You never know if they are actually letting the product sit on their skin. So they are just doing their work. You cannot judge them by that. So please, whenever you are doing anything with your skin, any changes with your skin, make sure you are referring an expert for that. As said by, very correctly said by Dr. Today, that everybody has a different skin, and you should treat it like that, like your own skin. Moving ahead, we are talking about acne management today, and we are in discussion with Dr. Liji. Let's talk about the next thing. Uh, the question next is, doctor, what to do for people, because you have mentioned sensitive skin. So what about patients with sensitive skin? Is it a little tougher for them? How do they deal with acne?
Yeah, for sensitive skin, for sensitive skin, we select or we choose products cautiously with, light-weighted moisturizers, non-comedogenic sunscreen, lightweight sunscreen, better, for sensitive skin, gel-based sunscreen, on all with gentle cleansers and all. So treating sensitive skin is always a trouble, but nowadays the sensitive skin is most of the time follows usage of this kind of over the counter products, and it's very difficult, but we'll treat.
Right, right. And specifically for people with sensitive skin, do not try anything and everything on your skin just like that. Just because your friends are suggesting you, or you have just seen some girl with a very beautiful skin applying those products. Don't do that, girls. Especially, please don't do that. You never know. It's not just the product; it's her genes also. Genes also matter when we are talking about skin. It Your food habits, your time, the time you sleep, the stress, the amount of stress you are taking, everything matters. And we are going to talk about everything today. We are in discussion about management, acne management. Let's talk about food, doctor. What are the food habits which anybody should adapt in order to have a clear skin or a good skin?
So, food, some kind of food will definitely aggravate acne. That you should not avoid. You should decrease taking high glycemic index, sugar, dairy products, chocolate, sweets, and all. And the fruits and vegetables always give you the general health along with the a glowing skin, especially vitamin C containing citrus fruits and all.
Right, right. Doctor, we also speaking about citrus food. I have seen a lot of people, chewing up the entire lemon. It's not just the juice, but I have seen people having the zest of lemon as well. In my village, it's very commonly used. Also, after having the lemon, we see rubbing the lemon on the skin. So basically, home remedies is something which we see everybody applying when we are talking about skin. Whatever happens, tan ho gaya, besan laga lo, ye ho gaya, multani mitti laga lo. There are also a lot
Exactly.
of home remedies. I have seen girls and boys, like whenever the leftover fruits or vegetables are there, they make a paste of it and then they apply it. Also, speaking here, influencers are giving whatnot recipes for skin. So basically, they are making nice recipes to treat their skin better. So, how helpful is that? And if it's not, how can it harm our skin?
I would say you eat it, baby. Eat instead of rubbing it over the skin for get a better result. Something the lemon, the home remedies, lot of things. All those are not having scientific evidence that the raw material rubbing on your skin will result in irritation, irritant contact dermatitis. Lot of that kind of home remedies are photosensitive. After application, whenever we are exposed to sunlight or UV rays, it will again cause irritation, further inflammation, and worsening of the skin condition. Though, so there is no point in rubbing your natural things and all over the face. No, there is no point in using home remedies. You can take it as food, good fruits, good vegetables, and all for your general health and for a good skin, but You should consult your doctor before starting topical application. Don't believe in this kind of home remedies.
Right. Also, doctor, we nowadays get to see that sunscreen has, I don't know what marketing they are doing. Also, we see our dermatologist continuously suggesting us that please apply sunscreen. It's so important nowadays. When we were young, we have never heard our parents asking us to apply sunscreen while going out. I have never done it in my childhood. So nowadays, it has become a must for everybody, for people who are out in the sun, who are inside their homes, who are walking in front of the screen. Sunscreen is a must. So, what is the role of sunscreen in acne management? Is it important?
Yeah, of course, it is important. If you ask me, doctor, select one thing for maintenance of acne, I would say you have to use your sunscreen. Sunscreen is the must do for acne. Not only for acne, for any of your skin conditions on your face, sunscreen is the must thing. One thing is, whenever the inflammatory acne occurs, it will heal, sometimes spontaneously or even without treatment it will heal, but it will give the residue, that pigmentation, that marks. Sunscreen is having that that quality to prevent that kind of pigmentation. And the use of sunscreen is, you should keep in mind that adequate quantity you are using every 2 to 3 hourly you are using, irrespective whether you are inside your house, outside your house, whether it is rainy season or sunny day, whatever. Okay, sunscreen is the must do thing. The most important thing is to prevent the pigment changes after healing of the acne.
Right. Doctor, because we are talking about sunscreen, the common mistake, the most common mistake we make is choosing the sunscreen. So, how do we choose the right sunscreen for the skin? Most of the people are worried regarding this because they are not finding the perfect sunscreen for the skin. So, how do we
Yeah.
choose it normally?
Yeah, first of all, you should look for the SPF value. SPF 30, 50, above that, everything is available nowadays. 50 is a good choice. 50 or above SPF is a good choice. Another thing is, the preparation is selected based on the skin texture. It's oily condition or dry condition. For more oily skin, better we choose gel based sunscreen. For extreme dry skin, we can choose water based sunscreen or oil based sunscreen. Okay, this is how you choose sunscreen. And some, nowadays we have tinted sunscreen also. It's a good thing actually. Some, teenagers or some people with makeup is necessary for their profession, they can choose that tinted sunscreen also. That will give you a fine finishing over your face that looks like a makeup, but it is safer as compared to makeup. It's much better. So this is how you choose sunscreen depending upon the skin texture. Even with complexion, the tinted sunscreens are available according to the complexion also. Then according to the dry skin, oily skin, acne prone skin. For acne prone skin, always choose non-comedogenic sunscreen. Okay, all right.
Right. Doctor, also, according to the climate condition of India, what is the basic SPF which is required to be in our sunscreen?
Yeah, it's enough. 30 is actually enough. If, more than the SPF, how much quantity we are using, how often
Right.
we are using, that is important. Even with the 30 SPF, sunscreen can work well with, if you are using every 2 to 3 hourly, indoor as well as outdoor, at least one finger length for entire face, another finger length for your neck. This is most important than SPF. When you ask about SPF, 30 is enough. If it is 50 or more, much better. That's all. That's it.
Right. Right. Doctor, also there are a lot of foundation products, which includes sunscreen as well. So it's written there: foundation, concealer, and sunscreen. So, girls who are thinking ki yahi only if we apply this it will work. So does it work like that? Do they also need to apply sunscreen on top of that?
Actually speaking, in my knowledge, there are no pharmaceutical companies are launching this kind of product. Only the cosmetology products in the markets. They can use tinted sunscreen. I would say tinted sunscreen more than this kind of product. If makeup is necessary for their profession, they can use light-weighted makeups, minimal makeups.
Mm,
Okay, rather
mm.
than using this kind of. Whenever we use multiple layers of makeups, lot of makeups, always, logically it will cause the block in your pilosebaceous unit that will result in acne. And moreover, make sure you remove your makeup before going to bed. Please don't keep your makeup overnight. That will always aggravate acne by occluding, just clogging your oil glands.
Right, very important, very, very important for girls who needs to apply makeup on a daily basis. Uh, I am sitting right in front of you. I need to apply makeup on a daily basis every single day. So definitely my skin needs to breathe, and whenever I get a chance, I try staying away from makeup as far as possible. So at today's day, I am fed up of makeup. Being a girl, we can never dislike it, but I get tired of applying it sometimes. But it's so much important. I know I can relate to things such that after a long, tiring day, I feel like coming home and just go to sleep. I don't feel like doing anything, but please don't do that. It can be the worst thing you are doing with your skin, not removing your makeup. Clean it, wash it. Doctor, how can we clean? What is the proper way of cleaning it? We see a lot of girls, they just apply some cleansing cream, rub it with the cotton, and then maybe just because they are tired of doing it. But what is the
Yeah.
proper way of cleaning it, if you can please
You
explain?
know, you can use simple moisturizers, even the petroleum jellies, and simply Vaseline like
Hmm.
petroleum jelly is enough. You can gently take this with a cotton, wisp of cotton or a fine tissue paper and just remove it off. No need of multiple products. No need of multiple products. You can just simply remove this with this kind of petroleum jelly. After that, cleanse your face with your skin friendly cleanser or your skin friendly face wash based on your skin texture after getting an expert opinion from your dermat. That's only. After washing, you can use some moisturizers. Again, your skin type, depending upon your skin type, you can use your moisturizer. That's the best way. Remove it, use your moisturizer, keep it hydrated, keep it healthy. Hmm? Hello? Hello? Hello?
Yes, yes. I'm so sorry for the network glitch. But yes, we are talking about skincare products now. Doctor, because we are talking about makeup, let's talk a little bit more about it. What about the patients who are suffering from acne issues, or the patients who are suffering, who are in a second stage or third grade of acne management? Do we suggest them makeup? Is that fine? Or what if they need to apply it? What would be the best possible way of applying it?
Yeah, that we have mentioned earlier. Makeup is actually not good for your skin. Whenever you have acne, you're making it, technically you're blocking your pilosebaceous unit. So it's not good always. I would say if makeup is must or necessary for their profession, they can use light-weighted makeup only and make sure you remove it after a few hours. Don't keep it for a long time. That's all. It's not actually good.
Right. Doctor, because we are talking about skin, we know that hydration plays a very important role.
Yeah.
So, how important is it to keep yourself or if your body hydrated? Does it play an important role in acne management as well?
Yeah, have you hydrating your body inside out is important. Both taking lot of plenty of water as well as hydrating your skin and moisturize your skin properly. Keep it hydrated and healthy. It is important.
Right. Now, let's quickly dive into the rest of the questions. We see some questions coming from the viewers. The first question is, Doctor, can dairy products worsen acne?
Yeah. Some studies show significant relation with the dairy products. In my experience, also, we often observe that most of the patient come with the aggravation of the lesion whenever they take dairy products. Like that peda items, that milk. Dairy products aggravate acne. This will aggravate the insulin resistance, especially in PCO, underlying PCO and all. It will aggravate acne. Dairy products. You should don't avoid dairy products. Take little bit, but you should reduce it.
Right, right. Doctor, also because it's about skin, we see a lot of people, like whenever we have any skin issue, we see people distancing themselves from us. So let's talk about, we are talking about acne here. So is it contagious? Is it possible that somebody is using somebody else's towel or their intimate pillow covers, or let's talk about it. So
Yeah.
is it possible that the acne can spread from one person to another in that way?
Yeah. Actually, acne is not a contagious disease, but multifactorial etiology is there. One among that is the Propionibacterium acne. This is a kind of bacterium over the superficial layer of our skin. So for all kind of skin disease, or for general health, we should not share our personal belongings like towel and all. Basically, acne is not contagious, but even though there is a chance of getting propionibacterium between persons, so better use our own product. Nothing. No, please don't share your personal belongings.
Right. Doctor, also, we see a lot of changes coming on the skin of such women who take oral contraceptive pills on a regular basis. So, can that also trigger acne? Is it possible?
One among the cause is the hormonal imbalance. Whenever we take, there is an entity called drug-induced acne, drug-aggravating acne. OCPs are one among that. This multiple types of sex hormones are inside the OCP that eventually aggravate acne. But for a PCOS, that is a PCOD, when acne is associated with the PCOD, when a gynecologist start treatment for PCOS along with we dermatologist start acne treatment, for the combining these two treatment will give better results whenever there is underlying hormonal issue.
Right. Doctor, also, there is another question from a viewer who asks, can oily skin contribute to acne?
Yeah, along oil gland hyperactivity is a one cause of acne among the multiple causes. Yes, some that is why it is distributed on the more oily part of our body, that is a T space or face, upper chest, upper trunk. So they are more seborrheic. We say seborrheic, more oil secretion, more chance of getting occlusion on their oil glands. That will again lead to acne, because these oils are carrying triglycerides, free fatty acid, everything. They are inflammatory based. The pathology is inflammatory. That will eventually cause that redness, tiny bumps, then eventually bigger lesions. So more oily faces, there's a chance of getting more acne.
Doctor, we are particularly talking about acne on the facial area, but what about acne throughout the body? How do we deal with body acne?
Yeah, sure. Acne not only present on face, it can occur found to occur over the body also, but the distribution is over the upper body, shoulders, and all.
Hmm.
The treatment is
Hmm.
just like face acne only, but the thing is, for face acne, we need a little bit topical therapy. For triangle acne, we need much more bigger quantity. So, triangle acne, most of the time, here comes the role of systemic treatment. Whenever we take oral medication, it will give good results for face as well as triangle lesion. Along with that, liberal use of some kind of topicals are also there, with the benzoyl peroxide, gel preparations are there, gel wash preparations are there, salicylic acid peel, we can use it for triangle acne also. But more than topical therapy, the systemic therapy will give better result for both acne, both facial as well as triangle acne.
Right. Doctor, we also see, mostly what we see is patients, they are just going with the issue when it's in the face. They don't put a head in whatever is happening in the body, especially if you're talking about women. They normally go to the dermatology before they're getting married. Let's talk basic. Before they are getting married, there is a line in front of the dermatologist chamber before the marriage session or wedding session. Um, because women, they normally go to the doctor with, stubborn marks, because they have been neglecting it since years now. So for the people who are leaving it untreated, or the people who are thinking ki, this can't be cured, so let it be, my face is fine, I look fine, whatever is happening in my body, it does not matter. So what suggestion do we have for them? Can leaving it untreated somehow, worsen the symptoms of acne?
No, actually, face as well as body. For a dermatologist, I would say you have to treat your entire skin, because a glowing skin is not about your face only. We have to keep your skin like even tone, even complexion. That is a healthy, beautiful you, as you say, the spotless, beautiful skin. And there is no severe complication for leaving your acne lesions on your body actually. But better you treat. Not only over the face but also over your all your lesions on the body to get your skin with a uniform tone.
Right, right. Doctor, there is another question from a viewer who asks, how can stress influence acne?
Okay, yes. Stress always aggravate acne. Not only for acne, stress is a non-aggravating factor for various dermatoses. Stress definitely aggravate acne. There is a lot of complex things that are occurring in our brain, and it is related to skin and its metabolism, and that's how stress aggravate acne. This is a non-cause. Not only for acne, for any kind of most of the dermatoses, stress aggravate.
Right. Doctor, also, what we get to see today is people, they sleep very late at night. Also, they get up very, very late in the morning. So this has become a vicious cycle, and I see everybody following this, maybe because of the work, or maybe after the entire day, they just lie down in the bed with their smartphones scrolling the internet. So can those habits, sleeping late and getting up late in the morning, can those habits also trigger acne somehow?
Somehow up to some extent it will trigger, because actually we have to take a good sleep at least 6 to 8 hours cyclically on the same time, same hours. That will keep your circadian rhythm, that will keep your general health as well as your skin health better.
Right. Doctor, let's also talk about diabetic patients. We know that any disease, any condition, it takes a little time for them to get cured. So, what about acne? Is the treatment procedure different for diabetic patients?
Not that much difference in diabetic patient. Generally, they have to take care their general lifestyle modification better. Regular exercise, low carb diet, all will help them to cure it out. Not that much difference in non-diabetic and diabetic patient. Usually, the majority of population with acne are seen in the adolescent period. The number of adult acne is little bit lesser as compared to the adolescent acne, but we have a lot of acne patients in adulthood. Yeah, if they are having diabetes along with the treatment of diabetes, they know that their lifestyle modification will affect better result in diabetes as well as for their skin health, especially for acne.
Right, right. Doctor, there is another question coming from a viewer who asks, can hormonal imbalances cause acne?
Yeah, definitely. I have mentioned earlier, no, the multiple causes of acne. One causes a hormonal imbalance. For example, PCOD. I am sure that everybody have heard about PCOD nowadays. It's a condition which have the significant hormonal imbalance that will aggravate acne.
Right, right. Well, we had a wonderful discussion on acne management. Doctor, before we take a leave today, any take-home message for our viewers who has watched us so far?
Yeah, nothing more. As we have discussed earlier, acne is a treatable condition. A prompt treatment, adherence to therapy will always give you wonderful result. to prevent your acne, to cure your acne, to prevent the further sequelae like pigmentation and scarring. Always consult to a dermatologist. Please, please, please don't blindly behind your influencers, reels, home remedies that eventually ended up with worsening of your skin condition. Always make sure you consult to a dermatologist after getting your proper skincare and start your acne treatment. And please be adherent to your therapy. That is how you will definitely get a beautiful spotless skin. Thank you.
Well, that was absolutely wonderful, Doctor. We thank you so much for your valuable time today. It has been a very, very informative session for our viewers. And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and
Thank
stay
you.
healthy.
Thank you.